Hello everyone, back again. We're see if we can get this right. I'm trying to live stream some USMLE review questions. Basically, I'm just going over the summaries that I'm seeing on some of the websites, and I'm doing this because it's a great way to review. So if you are here to listen to this, thanks very much. And remember that I also have a podcast called Med School Radio, which you can find on iTunes and on Spreaker and other other podcast places. It's 3:53 a.m. here. I'm a little bit tired, but I'm just going to end the study session with reading of some summaries, so let's go for it. These are just mixed ones. Let's start with akathisia. This is an extra pyramidal side effect of antipsychotic medication characterized by inner restlessness and an inability to sit or stand in one position. Treatment involves a reduction in the antipsychotic dose, if possible, or the addition of a beta blocker or benzodiazepine. The filtration fraction is the fraction of plasma flowing through the glomeruli that is filtered across the glomerular capillaries into Bowman space. Renal plasma flow can be determined by renal blood flow by multiplying the renal blood flow by 1 minus hematocrit. Okay, cancroid. You know what that is? Cancroid, due to Haemophilus ducreyi, presents as deep, painful U. ducreyi with H. ducreyi ulcers with ragged borders that are associated with a gray exudate and inguinal lymphadenopathy. Diagnosis is established by a gram stain and culture of the organism from a scraping of the ulcer base. So we are going live here on YouTube. I'm just going to be checking the settings here, seeing if anybody's joining. Go ahead and make comments if you'd like to, or talk with yourselves about what you think the answers are, or what are the exudate and origins of some of the questions. Some of them you're going to remember very clearly. So this is cancroid. So remember, this is the painful type. And diagnosis is established by a gram stain and culture of the organism from a scraping of the ulcer base. Okay, moving on to the next one. Patients with urea cycle disorders typically have discrete episodes of vomiting, tachypnea, and confusion coma secondary to hyperammonemia, which is a metabolic emergency. Ornithine transcarbamylase deficiency is the most common disorder of the urea cycle and is characterized by hyperammonemia and elevated urinary orotic acid. So that was ornithine transcarbamylase deficiency. Okay, next one. Root cause analysis is a quality improvement measure that identifies what, how, and why a preventable adverse outcome occurred. The first step involves collecting data, mainly through interviewing multiple individuals involved in the steps leading to the outcome. So a typical question here would be from one of the Q banks where there is a problem that occurred and they're wanting to know what they should do in order to solve the problem so that it doesn't happen again. And in this question, they're saying that you have to interview the participants in the trouble, whatever went down, and to find out what happened. So that's a very normal procedure. The next thing is physicians should disclose medication errors and provide an apology in a timely fashion, regardless of whether the harm has occurred. So this again is in the case where there is a problem that occurred, a mistake, and it's important to quickly disclose the medication errors, to provide an apology, and do it quickly. And in that case, you could probably avoid anger from the patient and a possible lawsuit. Next, physicians must be cautious about discussing protected patient health information in public places, including public settings within the hospital, even with other medical personnel. Conversations regarding patients should be deferred to a later time when a more private setting can be arranged. This was a question, I believe, about a med student asking a doctor a question in the elevator regarding a patient and where this type of conversation is appropriate. Next, let's talk about superficial and deep inguinal rings. The superficial and deep inguinal rings are physiologic openings in the external abdominal oblique aponeurosis and the transversalis fascia, respectively. Surgical repair of an undescended testicle lodged in the inguinal canal involves moving the testes through the superficial inguinal ring and fixing it in the scrotum, for example, with orchiopexy. So I'll read that first part at the top again. The superficial and deep inguinal rings are physiologic openings in the external abdominal oblique aponeurosis, that's the superficial, and the transversalis fascia, that is the deep inguinal ring. Of all the antiviral agents that bind and inhibit DNA polymerase in the herpes virus and reverse transcriptase in HIV, the pyrophosphate analog, which is called foscarnet, is one of the few that do not require intracellular activation by viral or cellular kinases. So remember that it's foscarnet that doesn't require intracellular activation by viral or cellular kinases. Pernicious anemia is an autoimmune disorder caused by the cell-mediated destruction of parietal cells. And these are in the superficial upper glandular layer of the gastric body and fundus. Parietal cells are responsible for the secretion of hydrochloric acid and intrinsic factor, a glycoprotein involved in the absorption of B12. Deficiency here leads to megaloblastic anemia and neurologic dysfunction. Okay, let's look at the next one. Mycophenolate is an immunosuppression drug that inhibits inosine 5 monophosphate dehydrogenase in the de novo purine synthesis pathway. It provides relatively specific suppression of lymphocyte proliferation, which is largely because activated lymphocytes lack an established purine salvage pathway that is present in other hematopoietic cell lines. So that's mycophenolate. Next, let's talk about Sertoli cells. Remember that they produce inhibin in response to FSH from the anterior pituitary. Inhibin suppresses FSH production in the pituitary. Sertoli cells also facilitate spermatogenesis within the seminiferous tubules. Impaired Sertoli cell function would lead to decreased production of inhibin and increased FSH levels and impaired fertility. So if you're tuning in now, we are just reading some of the USMLE summaries from QBanks. Vertical transmission of hepatitis B from pregnant females to the unborn child can occur in women with active hepatitis B infection. The presence of HBeAg, which is a marker of viral replication and increased infectivity in the mother, greatly increases the risk of vertical transmission of the virus. Because of this concern, the newborns of all mothers with active hepatitis B are passively immunized at birth with hepatitis B immune globulin, which is HBIG, followed by active immunization with recombinant HBV vaccine. For diagnosis of schizoaffective disorder, psychosis must occur in the absence of major mood episodes, but mood episodes must be present for a majority of this lifelong illness. In bipolar disorder and major depression with psychotic features, psychotic symptoms occur exclusively during mood episodes. So that's bipolar disorder. So this is easy to get confused. So you must remember that for schizoaffective disorder, the psychosis occurs in the absence of major mood episodes, but for bipolar disorder and major depression with psychotic features, psychotic symptoms occur exclusively during the mood disorders. The omphallomesenteric or vitelline duct normally obliterates during the 7th week of embryonic development. Both enterocysts and Meckel diverticular result from a failure of obliteration during the omphallomesenteric duct. Fibrate medications, for example, fenofibrate or gemfibrozil, inhibit cholesterol 7A hydroxylase, which catalyzes the rate-limiting step in the synthesis of bile acids. The reduced bile acid production results in decreased cholesterol solubility in bile and favors the formation of cholesterol stones. Streak ovaries, amenorrhea, and infertility are the gynecologic complications of Turner syndrome. In addition, patients with Turner syndrome usually have short stature, webbed neck, shield chest, and low posterior hairline. And remember that it's the bicuspid aortic valve which is the most common cardiac comorbidity. Man, I'm tired. It's 4 a.m., but I'm still doing this. Why am I doing this? It's fun. Consistent use of barrier contraceptives is extremely important for preventing sexually transmitted infections, including human papillomavirus or HPV. Patients infected with carcinogenic strains of HPV, for example 16, 18, and 31, are at risk of squamous cell carcinoma of the cervix. In vitro fertilization using a donated ovum is the most promising means of achieving pregnancy in a woman with Turner syndrome. Pregnancy can occasionally occur spontaneously in some patients with Turner syndrome, but the risk of spontaneous abortion, Down syndrome, and Turner syndrome are all increased in such cases. I'll read that again. Pregnancy can occasionally occur spontaneously in patients with Turner's, but the risk of spontaneous abortion, Down syndrome, and Turner syndrome are all increased in such cases. Okay, apoptosis or apoptosis, however you want to say it, can occur through either the intrinsic or mitochondria-mediated pathway or the extrinsic, which is the receptor-initiated pathway. Both pathways converge in the activation of caspases. Caspases are proteolytic enzymes that cleave cellular proteins. As an antioxidant, superoxide dismutase neutralizes reactive oxygen species, preventing cell injury. In a pathologic state such as post-ischemic reperfusion, oxidative stress is high, and reactive oxygen species production exceeds the neutralizing capability of antioxidants, leading to increased cell damage and death. So that is the antioxidant superoxide dismutase. Remember that it neutralizes ROS, or reactive oxygen species. Gastrointestinal mucosal injury and bleeding are the most common side effects of aspirin. These are due primarily to cyclooxygenase 1 inhibition, which results in impaired prostaglandin-dependent GI mucosal defense and decreased platelet aggregation. Next, let's talk about vitamin E deficiency. This can occur in individuals with fat malabsorption. Deficiency of this fat-soluble vitamin is associated with increased susceptibility of the neuronal and erythrocyte membranes to oxidative stress. Clinical manifestations include ataxia, impaired proprioception, and vibratory sensation, and hemolytic anemia. So that is vitamin E deficiency. Remember, this can occur in individuals with fat malabsorption. The celiac trunk is the first main branch of the abdominal aorta. It provides oxygenated blood to the spleen, stomach, liver, and abdominal esophagus as parts of the duodenum and pancreas. The proper hepatic artery branches off from the common hepatic artery from the celiac trunk and provides arterial blood supply to the liver. Psoas abscess presents with fever, back, or flank pain, and inguinal mass and difficulty walking. Inflammation of the psoas muscle leads to pain with extension at the hip. For example, the psoas sign. Psoas abscess can develop due to hematogenous or lymphatic seeding from a distant site, particularly in patients with diabetes mellitus, intravenous drug use, and immunosuppression, for example, with HIV. So remember that this is regarding the psoas. So, thanks very much. Let's move to the next one. The deep brachial or profunda brachii artery and radial nerve run together along the posterior aspect of the humerus. Midshaft fractures of the humerus risk injury to these structures. So once again, if you have a fracture in the midshaft of the humerus, you can have problems with the deep brachial artery and radial nerve because they run together along the posterior aspect of the humerus. Temporomandibular joint disorder, or TMJD, is associated with derangement of the temporomandibular joint and hypersensitivity of the mandibular nerve. Remember, this is the cranial nerve of 5-3. All right, next one. The common perineal nerve is vulnerable to injury where it courses around the neck of the fibula. Fibular neck fractures can injure this nerve, causing weakness of dorsiflexion, which is the deep perineal nerve, and eversion, superficial perineal nerve of the foot, as well as loss of sensation of the dorsum of the foot. These are often confusion questions, so remember, so with dorsiflexion, we're thinking about the deep perineal nerve, and eversion is the superficial perineal nerve. So that is talking about the common perineal nerve injury. The median nerve is the most commonly injured within the carpal tunnel and leads to pain and numbness in the first 3 digits and lateral half of the fourth, as well as weakness of thumb flexion and opposition. More proximal injury in the forearm additionally causes decreased sensation over the thenar eminence and weakness of flexion in the wrist and second and third digits. Head and neck squamous cell carcinomas typically present typically spread first to the anterior cervical, i.e. the jugular, lymph nodes via the lymphatics. Distant spread occurs over regional lymph node involvement. So that is head and neck squamous cell carcinoma. Blunt trauma to the globe can cause orbital blowout fractures. These fractures most commonly involve the medial or inferior orbital walls due to the thin bone bordering the ethmoid and maxillary sinuses. So these summaries probably won't mean a great deal to you unless you've gone over the questions first. So I recommend you look at the Q-banks. You know what Q-banks I'm talking about. Look them over, go through them, but remember these educational points because this is what will be tested on the NBMEs and of course the USMLE. Let's keep going. The medial femoral circumflex artery and its branches provide the majority of blood supply to the femoral head and neck. Injury to these vessels due to displaced femoral neck fracture can cause osteonecrosis of the femoral head. So remember the medial femoral circumflex artery and the branches provide the blood supply to the femoral head and neck. Okay, let's do a few more. The hypothalamus is a key region responsible for homeostasis. The ventromedial nucleus mediates satiety. Lesions of this area of the hypothalamus can result in hyperphagia and obesity. So remember, the hypothalamus is a region responsible for homeostasis. The optimal location for needle insertion during a lumbar puncture is the L3-L4 or L4-L5 space, as this is well below the spinal cord termination site, which is L1 in adults. The L4 vertebral body lies on a line drawn between the highest points of the iliac crests. Okay, the last one for tonight is a common question that comes up, and it is about injury to Meyer's loop. Remember that injury to Meyer's loop in the temporal lobe results in contralateral superior quadrantanopia. So there we have it. Thanks very much for tuning in. And also please check out my podcast on Anchor FM, Spotify, and Apple Podcasts. Thanks a lot, and I hope to see you again soon.